Imagine a world where strength isn't measured by silence, but by the courage to speak up. Where vulnerability isn't weakness, but the ultimate act of bravery. Today, we're diving into a crisis that's been hiding in plain sight: men's mental health. It's just time to break the silence and challenge the stereotypes that have kept too many men suffering alone. Welcome to the Brain Talk Sessions YouTube channel. Your journey to a healthier mind starts here, where we share psychology explained for everyday life. The statistics are alarming. Globally, men are dying by suicide at rates that should shock us all. In the United States, a staggering 4 out of 5 suicide deaths are male. Across the pond in the UK, suicide stands as the leading cause of death for men under 45. These aren't just numbers, they're fathers, brothers, sons, and friends lost to a silent epidemic that's been allowed to rage unchecked for far too long. But why do men's struggles so often go unnoticed? Unlike a broken arm or a physical illness, the wounds of mental health are invisible to the naked eye. Men might mask their depression with irritability, throwing themselves into work, or turning to substances to numb the pain. Even those closest to them, family, friends, coworkers, can miss the signs, leaving men to suffer in silence, their pain hidden behind a facade of normalcy. From childhood, boys are fed a toxic message: real men don't cry. This cultural stereotype seeps into every aspect of life, teaching men that emotions are a sign of weakness. While resilience is a valuable trait, the pressure to constantly appear strong and stoic comes at a devastating cost. Men learn to bottle up their feelings, creating a pressure cooker of emotions that can lead to explosive consequences. In both professional and personal spheres, men often feel trapped by the expectation to project unwavering strength and independence. Admitting to emotional pain or seeking help can feel like admitting to a fundamental failure of masculinity. This stigma creates a formidable barrier, making men far less likely than women to seek therapy or counseling. Even when they do take that brave first step, many drop out early, finding the vulnerability required in therapy at odds with their ingrained notions of manhood. The roots of this crisis run deep, intertwining psychological and biological factors. Hormones like testosterone interact with stress responses in unique ways for men, often manifesting depression through aggression or withdrawal rather than stereotypical sadness. This can make diagnosis and treatment more challenging, as these symptoms might not fit the typical clinical picture of depression. Untreated mental health issues in men can lead to a dangerous increase in risk-taking behaviors. Whether it's reckless driving, financial gambling, or engaging in extreme sports, these actions often serve as a misguided attempt to find temporary relief or distraction from emotional pain. It's a high-stakes game of emotional Russian roulette, where the risks far outweigh any fleeting benefits. Substance abuse frequently enters the picture as a coping mechanism. Alcohol and drugs become a form of self-medication, offering temporary numbness from emotional turmoil. However, this solution only deepens the cycle of depression and addiction, dramatically increasing the risk of suicide. The gravity of this crisis is reflected in stark statistics across the globe. In the United States, suicide ranks among the top 10 causes of death for men, with males nearly 4 times more likely than women to die by their own hand. This disparity highlights deep-rooted cultural, medical, and systemic failures in addressing men's mental health needs. The United Kingdom paints a similar picture, with men 3 times more likely than women to die by suicide. This trend persists even in a country with a robust healthcare system, underscoring how deeply ingrained stigma can prevent men from accessing available help. In Australia and Canada, unique challenges emerge in rural and industrial settings. Farmers, miners, and other rural workers face higher levels of isolation and limited access to mental health services. In these communities, traditional notions of masculinity often run even deeper, creating additional barriers to seeking help or showing vulnerability. The obstacles preventing men from seeking help are numerous and complex. Many men live in fear that reaching out for therapy will damage their reputation, relationships, or career prospects. There's a pervasive belief that admitting to mental health struggles equates to admitting weakness or failure as a man. Even when men do overcome these internal barriers, they often find limited options for male-focused therapy. Most mental health programs are designed with a gender-neutral approach, which may not resonate with men who need more action-oriented strategies rather than purely emotional discussions. Workplace culture can be another significant hurdle. Many corporate environments reward productivity and toughness while viewing emotional openness as a liability. This creates an atmosphere where men feel unsafe discussing their struggles, fearing professional repercussions. But there is hope on the horizon. A movement is growing to break the silence surrounding men's mental health. Grassroots organizations are encouraging men to share their experiences, from veterans groups to community mental health projects. The power of hearing "I've been through this too" cannot be overstated. It can literally save lives. Celebrities, athletes, and public figures are lending their voices to the cause. When icons like Prince Harry, Michael Phelps, or professional footballers open up about their mental health battles, it helps normalize these conversations for men from all walks of life. Their courage in sharing vulnerable stories chips away at the stigma, one testimony at a time. Social media is proving to be a powerful tool in reducing stigma. Hashtags like #It'sOkToNotBeOK and #Men'sMentalHealth are gaining traction, creating online communities where men can find support and understanding. These digital spaces provide a level of anonymity that can bridge the gap where traditional systems have failed, allowing men to take those crucial first steps towards healing. Science-backed solutions offer concrete paths forward. The first step is often as simple as encouraging open conversations. Breaking the isolation by talking with friends, family, or colleagues can prevent mental health challenges from escalating to crisis points. Cognitive behavioral therapy, CBT, and mindfulness practices have shown particular promise for men. Research demonstrates that CBT helps men reframe negative thinking patterns, while mindfulness techniques reduce stress and build resilience. These approaches offer practical tools that many men find more accessible than traditional talk therapy. Peer support groups and community programs are creating safe spaces where men can be vulnerable without judgment. Whether in person or online, these groups provide a crucial sense of belonging and understanding that many men have been missing. Real change also requires action at the policy level. Governments and employers must prioritize mental health by increasing funding for targeted programs, offering robust employee assistance programs, EAPs, and training managers to recognize warning signs in their male employees. As we conclude, it's crucial to remember that while the men's mental health crisis is urgent, it is also treatable. With the right combination of awareness, support, and evidence-based interventions, lives can be saved. This is not a hopeless situation. Change is possible, and it starts with each of us. The call to action is clear. We must encourage men to speak up and society to listen with empathy and understanding. Every conversation, every shared story, has the power to create ripples of change. It's time to redefine strength as the courage to be vulnerable, to seek help, and to support others in their journey to mental wellness. We want to hear from you. Share your stories in the comments below. Your voice matters, and your experiences could be the lifeline someone else needs to hear. Don't forget to subscribe to join our community dedicated to breaking the silence around men's mental health. Remember, you're not alone, and it's okay to not be okay. Together, we can create a world where men's mental health is a priority, not an afterthought.